Welcome to Health Matters on Channels Television. We're glad to have you join us. The Centers for Disease Control and Prevention say that there are 100,000 to 300,000 cases of Lassa fever annually in West Africa, out of which approximately 5,000 casualties result. That's deaths. Even though the number of cases, according to reports, is coming down every year in Nigeria, the case fatality rate for this year is quite high. The Minister of Health has held an emergency meeting with all health commissioners and is activating more primary healthcare facilities, which, according to him, should ramp up the surveillance system in the country. Our guest today is a consultant medical microbiologist and lecturer at the Ben Carson School of Medicine, Babcock University, Dr. Olushola Shobowale. You're welcome to the show.
Thank you for having me.
These extra primary healthcare centers that are going to be put all around the nation, how do you think they're going to affect or improve surveillance?
On the long run, they're going to have a positive impact on case notification and the reporting system, and also on surveillance. You know, the basic idea is to have some form of healthcare professionals who have been trained in surveillance and disease notification, so that these things can be nipped in the bud as soon as possible. You see, the ideal thing is to isolate the first case, the index case, and then see how you can interrupt it from coming into the community, going across borders, affecting other states. So if you have, like as the Minister of Health has said, they're planning to start with 110 new health centers in conjunction with the existing ones. And so you have nurses that are trained nurses, we call them link nurses, or infection control nurses. You know, they will be given some basic training on some of these things. Yes.
So that if there's a suspicious fever,
exactly,
you know, a casualty doesn't have to result.
As we are seeing right now.
So that means that places like Niger State, where we had cases since August,
as was alluded to,
it shouldn't happen.
It shouldn't happen again. It should never happen again.
Okay, talking about contact tracing now. You know, the contact tracing here seems to be a bit different. It should be a bit different, I hope, than Ebola. Because when Ebola was here, we had one index case.
Exactly.
So everything came out of one person. But in this case, it's like just from the rats to the person, the rats to the person. And that looks like there's going to be so many more contacts. How is this going to be handled?
There's a basic dissimilarity between what we had with Ebola and what we're having with Lassa. Ebola was brought across the border by one individual. But in this particular case, you are having the vector, which is the rat, the multi-mammoth rat, which is widespread, you know, in the country, especially in certain states like Edo, Plateau, you know, states like that have high populations of these rats. And this part of the year, the dry season, or the relatively dry season, these rats are hungry, they're looking for what to feed, there's bush burning going on, so they're being driven into people's homes. So you're having pockets of isolated cases here and there. So it makes the scenario a little bit much more difficult. But I must say that government is actually on its heels, on its toes, doing its best to bring the cases down to the barest minimum.
But isn't there any fear that some contacts will be lost in the process?
That might be inevitable. There might be some cases that they may go off the radar. That could happen. That could happen. But I believe that with the scenario on ground, with the community health physicians, the infection control teams that have been set up, and clinical microbiologists and other healthcare professionals coming on board, like what Lagos State is doing right now. Lagos State government is doing a yeoman's job with the issue of contact tracing. And when we talk about contact tracing, we're talking about the primary contacts, the secondary contacts, and tertiary contacts. That like primary contacts could be doctors, medical healthcare practitioners that could come in contact with these patients, and then family members that come in contact with those healthcare professionals, and then other people that come in contact with those. So okay. I think right now
they're mopping up everybody.
Right now they have about 447 people that are under surveillance. Once there's any breakthrough fever, once they begin to manifest any of the clinical signs and symptoms like the fever, the sore throat, even the chest pain, these three that I've mentioned give a high probability. It's not absolute, but they give a high probability
that there's Lassa fever.
That there could be.
But when you say under surveillance,
yes,
these people are in their own homes, but they're being watched.
They're being watched.
Do officers go there every day?
Yes. The healthcare practitioners that are doing the surveillance keep tabs on them, monitor them, check on them periodically. They have their contacts, they have their phone numbers, and then they also notify people around them. Please keep an eye on them, tell us what is happening. So it's a concerted teamwork between the government and the populace.
Okay, so we come to labs now.
Yes.
Even if a case of Lassa fever is suspected, there have to be tests run on their specimens.
Yes, exactly.
How many labs are available around the country for this?
Now, before we talk about the issue of laboratories are also a portal for transmission of infection, of this infection.
Definitely.
Especially when they are spinning things, they are generating, some things we call aerosols that can be released
and breathed
into the atmosphere. But I know that with the high level of awareness right now, a lot of laboratories are taking precautions. But we also need to take cognizance of the fact that you could have some cases presented to some private laboratories without any of the classical symptoms, and then laboratory workers could also come down with this.
Okay.
So we need to also look at the laboratories, ensure that the practices are best practices that are going on there. Laboratories that can run these samples, like in Lut has the facilities to run it. In Irua, in Edo State, they can run some of these things. I believe in UCH and a few other specialized laboratories in the country. I must also say that our level of sophistication in terms of laboratory practice in Nigeria is evolving. It's not at its peak as you would have in some other countries.
So no BS for labs
at the moment. But I believe that from what happened with Ebola and now with Lassa, the next thing to go for is to have biosafety level 4 laboratories in at least each of the 6 geopolitical zones in the country. Because transporting specimens across states is also an issue.
That is a concern. Because time is of the essence.
Although these specimens are usually well packed, they are usually well sealed and all that, but you want to minimize transportation as much as possible.
Is it just the specimen that is the problem? The specimens are wrapped well and everything, yes. But how about the patient?
That's another issue.
Time is going, and time is important.
You see, when the India's case that had Ebola was taken to the United States, they said without any equivocation that, look, we have what it takes to handle this case. The ambulance that was used for that particular patient was made strictly for such cases. So there was no probability of it escaping into general population. The isolation ward. Now we also need to ask ourselves, how many of our hospitals have up-to-date isolation wards where you can actually do barrier nursing, the proper form of barrier nursing. So and you see, I keep telling people that infections are probably the black man's #1 problem.
So we should face it.
We actually should be at the forefront of developing such systems. And I'm happy with what Lagos State government did with Ebola. Now, this is another scenario that will test our capabilities. I believe that with the coming weeks, we'll be able to, hopefully, let me stick my neck out. Hopefully, get
in the coming weeks.
In the coming weeks.
Well, I join my hope with yours. If a person has Lassa fever, can he transmit it to somebody else before he starts showing symptoms?
Before he starts showing symptoms, I would say a plus or minus to that. And what I mean by that is, during the incubation period, the person is asymptomatic, and the vast number of cases, about 80% of infections, are actually asymptomatic. People could come down with mild or what we call clinically inapparent infections. That could happen. That could happen, and then the person just has
a cold, and you're treated
slightly
and you go
feeling
back.
unwell in some people, and then in more severe cases, you could now begin to see the patient coming down, needing supportive treatment, coming down with infection, and then you have the very severe cases that will be hospitalized. Usually, from what we are seeing now, because we have two forms, we have the one that is the Lassa that is always present, which medical practitioners will call the endemic form. And then we
always present?
All that is being transmitted all year round, where we have some of these mild infections.
Is that how it works?
In countries like Sierra Leone, all year round, you could actually have some very mild, like there was a study that was done somewhere, and they found that up to 10 to 20% of patients in a particular region, in a particular hospital, have what we call antibodies to Lassa, So then you now have what we call the epidemic form, where you now have, spikes, like we are seeing now. We have spikes like we're seeing now, okay? And that's where intervention needs to come in. But the general thing is that most of these things are actually spread by rats to human beings.
I was asking that question because of the last case where somebody died in Lagos. Apparently, from what is being said, it's like they suspect he got it from Edo State. But you see, he was in Edo State in December. And he didn't start showing signs
until the 12th of
January. So, I'm wondering...
The timeline,
in between that time, could somebody else have got it from him? There's no way to tell?
The possibilities are vast. It's possible. We can't really put our foot down and say, yes, this is how that could have gone. But the contacts are what we need to look at. Who are the people that came in contact with him? Who are the people that traveled with him on the bus while coming from Edo to Lagos? Or did he travel? By what means did he travel? So these are the key things we need to do to be able to nip it in the bud.
How long does it take to treat a case of Lassa fever?
Let me start with the severe cases. The severe cases will be admitted, and there are specific drugs that they will be given. And you could give these drugs for upwards of up to 12 days, 15 days or more. And then you would now lead to... But each case is on a case-by-case basis. And then you need to give what we call supportive therapy. You want to help the person recover. And then the person's immune system will also help to boost and fight the infection. But primarily you give medications that will help to eliminate the virus from the body. So it's a range. There's no specific time range, but you go up to 12 days, 15 days or more. And then you also want to be sure that you also want to do a test of cure. Once you've done all giving your medication, you also want to test and
to
see
make
that
sure it's truly
the person
gone.
is okay to go back into society.
Into the society.
But let me also say that it can persist in the body for quite some time, like we've established. We've seen it's been found in breast milk. It's been found in semen, so some men could also actually pass it to their partners.
So they might have a period of a period of waiting.
Exactly. In fact, in semen, it can last for up to 3 months. It can persist in semen.
It really is mimicking Ebola to some extent.
Yes, in some ways, because they are in the same clinical group of viral hemorrhagic fevers. They are viruses, hemorrhagic, they cause bleeding, and they come along with fever also.
Let's go for a short break. We'll take a short break now. When we come back, your questions. Stay with us.